Hello, welcome to the Medical Minute. I'm your host, Michael A. Weiss. The topic for today's show is how to use social media in hospitals. I recently spent 17 days in a very prominent New York City hospital, one which I've spent a lot of time over the past 25 years due to my different bouts with Crohn's disease. And while I was walking around the hospital, pulling my various intravenous medication poles with me, and just doing the floor walk and everything else the doctors recommended, I realized that not much had changed in the hospital since 1988, which was the first time I was hospitalized. That is, patients speak to doctors and other medical professionals during early morning rounds, and maybe for a few minutes later in the afternoon if they happen to come by or if some miss early morning rounds. But in total, it amounts to no more than an hour of the day. So what happens the other 23 hours of the day? Well, what really happens is that patients wait. They wait to heal. They wait for their medications. They wait for procedures. They wait for tests. But I don't understand hospital executives who still don't understand how to integrate social media in the hospital. After all, they have 23 hours of a captive audience of patients. These patients are not only there for medical purposes, but for someone like myself who spent 16 nights and 17 days there, I was a captive audience for food, for lodging, for social interaction. So there's 23 hours available where patients are roaming the hallways, talking to one another, comparing notes about different procedures. So this, I think, provides the perfect opportunity for social media in the hospital. What do I mean by that? Hospital executives should walk around patient floors with something as simple as a flip camera, which is what I'm using for this podcast. They should just start interviewing patients, obviously only patients who want to be interviewed. Ask them about their experiences, their fears, their hopes, what they like to do outside of the hospital, who they can't wait to see when they get out of the hospital. It's going to build hope amongst the patients. It's going to make them feel like they're a part of the environment. I think it's also important for these same hospital executives to use this flip camera and educate patients by interviewing hospital personnel who have job functions that patients don't really understand, like a phlebotomist or a charge nurse. What do? How can they help a patient? What is a resident? What is an intern? What's a physician's assistant? What's a nurse practitioner? You see, because then when a patient is aware of this information, they're going to start to feel like they're a real part of this environment where they may literally have to spend 16 nights and 17 days. The hospital may not like everything it hears from these patient testimonials, but one thing I can guarantee you is that when patients and their families learn that they're going to become a part of the hospital by way of the hospital's website or the hospital's YouTube channel or their Facebook account, they're going to be thrilled. They're going to be really excited that they're a part of this transformation in healthcare so that the atmosphere inside the hospital starts to feel more like 2012 than 1988.